When I became the mother of a premature baby 18 years ago, it was important to me that I was comprehensively informed about modern medical treatments, best practices, typical risks, as well as possible complications from a scientific point of view. A few weeks into the process, the doctors assumed me to have a medical background and spoke to me as equals. I was approached and informed regularly without having to ask. At this time, it was not allowed to read the child's medical record. Since the staff was worried, parents would misunderstand the content. For that reason, I was always anxious. They didn't tell me the whole story. Thankfully, the protocol has been changed since back then. In my opinion, decisions on how to deal with parents of a preterm or sick-born baby should always be made individually. Past experiences, personal backgrounds of family members, and their psychological situations need to be considered. Some parents may want all the details, some may not. Some can handle tough information better than others. Therefore, the NICU staff needs sensitive skills to recognize the specific needs of each affected family. At first glance, the need for parenteral nutrition might give the impression that something is seriously going wrong with the baby. For that reason, it is important to keep reminding yourself that a baby born too early is simply not prepared and ready to cope with other ways of nutrition than the parenteral way. Under natural conditions, babies at this stage of development would continue to be supplied with all their nutrients through the blood vessels in the umbilical cord for several weeks. Therefore, parents of premature babies should not compare the individual needs of their children with those of full-term babies. Over time, even these children will make their developmental progress toward enteral and oral nutrition. From this point of view, there is no reason to be unsure or anxious about this treatment.